Hello, so I am doing my wound video for my week. It was week 3 checkoff. So then for the wound video, what I'll do first is that when I walk into the room, I'll say, "Hi, my name is Taylor. I will be your nurse today." I will follow with 2 different identifiers. I will ask what your name and date of birth is. I will assess to see if they have any type of allergies. Do they have any pain? What's it on the scale? And to see if they need any medication for their pain as well. So then, before the procedure starts, I will make sure I provide privacy for my patients so they know that they feel comfortable and safe while I'm doing the procedure. And then I'll place all my equipment that I'm using on a clean surface. So I'll place everything in a nice clean area with nothing else on it. So I have my sterile dressing change here. This is my fake wound. And so forth. So I make sure it's all in there, and I'll make sure that the bed is at my hip level so it stays sterile with me and it stays in my sterile field. So then next, once I get all that on a clean surface, all my sterile stuff, before opening it, I will say the rationale of why we are doing this. So I will say that we are doing your wound change to make sure that there's no reservoir for an infection, that nothing changed, that we stay nice and healthy and clean. We will remove the old dressings to act like there were dressings on here. We remove the old dressings, clean it, irrigate it, and then put new dressings back on. If you have any questions during it or after or before, let me know and I'll answer them for you. And then I'll ask the patient if it was okay if I can start removing the wounds on their skin. So then first, I will do my hand hygiene, of course. My supplies are all prepared, and I will put regular gloves on because this part does not have to be sterile. So I'm putting on my regular gloves. Okay, so what I first do, my gloves ripped. Oh well. What I first will do is I will remove the gauze that is on my wound. I will remove the gauze that would be on my wound. Right now there's no gauze on it, but if there was, I would. So I would remove it, and I would assess for the coca of my wound. So I would look at the color of it, see if it's what kind of discharge it has with it, if it have a foul smelling odor to it, and the consistency and the amount of what is coming off of it. So I will grab my handy dandy Q-tips and my measurement device, and I will look for eschar and sloth, and I'll use a different cotton tip every time I do something different. So first I'm going to take my cotton Q-tip, and I'm going to check on the inside of it for tunneling or undermining of the wound. And once I check for tunneling or undermining the wound, I'll discard the Q-tip, throw it away, and then I'll get a new one from the package. And then I will measure the length, which this length is about 12 centimeters. I will get a new Q-tip, measure the width, which is about 2.5 centimeters. Throw that away, get a new Q-tip, and measure the depth, which is about 1 centimeter. And I'll use a new Q-tip every single time I do that. After that, I will dispose of the Q-tips and everything in the proper receptacle. I will remove my gloves and put them in the trash. And then I will perform hand hygiene after I'm done with that. So I perform hand hygiene. Next, what I'm going to do is put the sterile part. So now I'm going to put all my my PPE on. I'll put my mask and everything else on gloves. Well, not gloves yet. And then I will open up my sterile package away from me. And then I will start to prepare my sterile field. When I'm preparing my sterile field, I have to make sure that when I grab my sterile field, I can only go within 1 inch of my sterile field when I grab it to make sure I'm sterile. And I'll place it all in front of me, and that's my sterile field. Next, what I'll do is I will put my sterile gloves on, which I would not put this on this field. I just don't have room. Whenever I put my sterile field, this will be off to the side, and this will be my sterile field. But for the moment being, put my sterile gloves on. Cup And do like that, so stay sterile. Oh, okay, there we go. All right, now I'm sterile. So just act like I didn't do it on top of my sterile field. Okay, so the next what I'm gonna do is I have the wound. I have my wound. And then I will start to irrigate my wound. But I do not have a syringe. So what I'm gonna do, So what I'm gonna do is that, just act like my finger is a syringe. So I would put around 30 to 35 or 60 milliliters of water, depending on how bad the wound is and how bad to irrigate it. And then once I'm irrigating it, I will grab a couple gauze pads, and I'll have my patient lay on their side so it catches it. Gauze pads is underneath, and then I'll start irrigating. And then I will irrigate the wound until I start seeing clear liquid coming out of the wound. So if I were like right here, I'd put gauze underneath it, and I would irrigate it until I see clear liquid coming out of the wound. And then once it's done irrigating, and make sure the wound is clear, then I will start to pat dry the wound with a clean thing of gauze every single time. I will not use the same gauze multiple times in a row. So I will start right there, clean up, dispose. Next one, clean, dispose. And then dry it until you think it's dry enough. We'll clean, dispose. And I would dispose the gauze in the proper trash. And then next what I'll do is I'll have my packing. So I have a moist gauze for packing. And then I will start, then I'll use a cotton tip applicator to start packing the wound. And then I would pack in the wound until it's all covered, starting from the top to the bottom. But my applicator is not sticking, so. Okay, so that's not working. Let me use gauze. So just say I use this. I packed it. So I packed it with my cotton tip applicator from the top to the bottom. And then it's all packed. And then I will, once it's packed, I will apply gauze over top of it, like so. Then I'll put a bandage over top of it to cover it if my wound was a little bigger, if I needed to. And then I will put tape. I don't want to take it right now, but I put tape around it to secure it all the way down. And then once I'm done with that, I will sign, date, initial, and put the time of when I did the dressing change for this patient. And I stick it right on there on the side. And then that would be done with my dressing change. After that, I will remove my gloves. Perform hand hygiene. Dispose of that. Perform hand hygiene. Okay. Then I'll talk to my patient again, ask if they're feeling any pain or any discomfort after I did the wound care. And then they say yes or no. Then I'll make sure my side rails are up in the bed. The bed is in the lowest position. Call light is in reach. The bed is locked, so it's not going anywhere. And then after all that, I will pick everything up, throw everything in the proper receptacle, take my gloves off, put hand hygiene, and then ask if they need anything else, thank them, and then